team, welcome back. It's Nurse Eunice, and in this video I'm going to show you how to put on and take off your gloves. Yes, remember, as a CNA you cannot perform sterile technique. You're not a patient care tech. You're not a hospital level CNA. So you perform clean technique only, which means that you just use the traditional gloves that will be located within your patient rooms. Just take them out of the box. You have to wash your hands first. We don't want to be contaminating these gloves, because if your hands are dirty, that means that these gloves will be dirty also. So wash your hands before and after removing your gloves. And let's get started. So I have clean hands, and now I'm going to apply my gloves. These are nitrile gloves. I want you to be mindful of any skin allergies you may have. So if you're allergic to latex, just make sure you read. And then also, my future CNAs, make sure that when you're restocking, when you're replacing the gloves, that you replace them for every person that you work with. So just don't replace the medium-sized gloves. If there's a size that's missing, be mindful and replace those too. All right, so let's get started. I'm going to put on my gloves. I have clean hands. I'm going to find the thumb of the glove. So there's the thumb. I'm going to put the first glove on. Glove is on. And let's repeat that process on the other side. I usually start by putting the glove on my dominant hand first. Is that a requirement? No, it's just something. It's a good technique, but it's not a requirement. So now that I have the gloves on, we call that donning. Now that my gloves are on, I want to show you how you should hold your hands once your gloves are contaminated. Never bring the gloves towards your body. Always keep them out and away. If there is a contaminant, if there are some fluids, it's okay for you to have them fall onto the floor, because you can always go back and clean the floor. What you can't do is have it fall onto your uniform. And so you want to stay as clean as possible, especially when you're working a 12-hour shift and you have so many patients who need you to remain clean, to take care of them. So now that I have soiled or contaminated gloves, I'm going to start removing them, not at the very edge. If you try to do so at the very edge, you're going to contaminate your skin. So about an inch below the cuff of the glove, I'm going to pinch and pull off. So now this clean hand cannot touch the outside of this glove. If we do, this hand becomes contaminated. So what we're going to do instead is you can take 1 or 2 fingers, you're going to go under the glove, you're going to pull it off, and then you're going to discard of it into the appropriate waste receptacle. Why do I say that? Because if it has blood on it, it's going to go into the biohazardous waste. But if it's just regular tissue paper or something, it can go into the trash. So let me dispose of this, and I'm going to have you teach me how to perform the skills next. So go ahead and get your gloves, and we'll get started shortly. All right, team, I'm back and I have my clean gloves. Doesn't matter which glove I put on first. Should I start with my dominant hand or my non-dominant? What do you think? If you said dominant, you're right. Let's go ahead and put that glove on. Find the thumb, glide it on. All right, so glove number 1 is on. Let's go ahead and glove the second hand. Remember, these are not sterile gloves, these are clean gloves, and you can put them on after you've washed your hands. All right, so now we're gonna pretend as if the gloves are contaminated. How do I remove my glove? Do I start from up here first? Is this correct? That's right, that would be incorrect. So hands pointed downward, you're going to pinch, and pull off. Contain the removed glove. Now, can I touch the outside of this glove? I cannot, but I can take 2 fingers. I can go beneath. I can remove the glove. Don't touch the inside, but you can touch the outside. And you're going to take this and you're going to put it in the appropriate waste receptacle. Now, what do you do with your hands? If you said wash your hands, you're absolutely right. Look, you all, I'm so proud of you. You just learned how to don or put on and doff or take off your gloves. And I look forward to seeing you in the next video. Bye. Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook available at booksbyeunice.com or nurseeunice.com.